welcome to our show Health and Wellness Myths and Facts. Now, health and wellness are essential to living a fulfilling life, and as the body ages, it becomes prone to several medical conditions. Aging can't be prevented, but we can learn to deal with the issues that arise in order to keep our loved ones in good health. People are living longer all over the world. Most people nowadays can expect to live into their 60s and even beyond. Every country in the world is seeing a population growth as well as an increase in the number of elderly people. Now, aging leads to a gradual decrease in physical and mental capacity and a growing risk of the disease. Well, the prevalence of most chronic diseases and conditions such as diabetes and heart ailments increase with age, and every day millions of people with chronic conditions struggle to manage their symptoms. Proper knowledge about chronic conditions such as diabetes can help elderly people manage them well. There are also many queries regarding lifestyle, medications in elderly people. We have an expert panel today to address all your doubts. Dr. Aasim Maldar, DNB Endocrinology, SCE, Royal College of Physicians, UK. He's an MD General Medicine, endocrinologist and diabetologist at the Hinduja Hospital in Mumbai. We also have Dr. S H Chavan, MD General Medicine, DNB Cardiology, Interventional Cardiologist, joining us from the Asarfi Hospital in Dhanbad. Thank you very much, doctors, for being with us. Dr. Maldar, to you first. It is said that even fully vaccinated people are not immune to Omicron. Can a third dose of the coronavirus vaccine shore up an antibody response and add some protection against this new variant?
Okay, so I'd like to begin by saying season's greetings to everyone and thank you for the question. Basically, we all know that Omicron is the novel variant of COVID-19. The first case of Omicron was reported around a month ago from South Africa. So the data regarding Omicron is still forthcoming. So what do we know about Omicron is, I would like to give a few highlights. First thing, there was a Government of India briefing a couple of days ago. So the key points were that amongst the patients infected with Omicron, 91% of the patients were fully vaccinated. However, only 70% of the patients were symptomatic, and severe disease was present in only 1 to 2% of the patients. So from this we can infer that though fully vaccinated patients can get the infection, the vaccine protects against symptomatic disease, it protects against severe infection. Then there is data about in-hospital mortality, which says that only amongst the patients who have died due to Omicron, 13% were fully vaccinated. So again, we can infer that the vaccination protects against mortality. Then there is real-world data stating that vaccine protection against infection is almost 40 to 60% for Omicron variant. Also, the companies claim that booster doses offer a higher protection against the infection. So looking at the overall data, we can infer that advising or offering a booster dose or a precaution dose to healthcare workers and elderly patients with comorbidities seems like a rational decision. As and when we get more data about Omicron, the decision to offer booster doses to other subsets of population can be taken with informed decision can be taken over time.
All right, so more informed decision will be taken over a period of time as we learn more about it. But Dr. Chavan, there are a lot of, there's a lot of speculation about Omicron. Will existing treatments work against it? Will additional research be needed? Where are we at?
We are battling this COVID-19 virus since last 2 years. And a lot of things have evolved in terms of our understanding in the disease process and treatment strategies over the last 2 years. So Omicron is nothing but a mutated strain of COVID-19, and as any virus has a natural tendency to mutate. So pathophysiologically, the disease process or disease course is going to be same as in the previous strains, except probably it is a milder as we get reports from all over the world. And so as the treatment strategies probably is not going to change, and all the current treatment guidelines will should work in Omicron variant also. Yes, introduction of new drugs, new research is going to happen, and as it is a never-ending process. But probably one important mistake, rather, which we did in the second wave, that we were completely unprepared, and that led to the acute shortage of drugs, oxygen, manpower. So we should be properly prepared this time. So government, administration, and individual hospitals should be properly prepared for the third wave with Omicron. Though it looks like a mild, but the spread is very fast, so probably will be overburdened with the cases in next 1 or 2 months.
All right. Well, very interesting. A lot still clearly unknown and needs more research. But Dr. Maldar, elderly people who have, a weaker immune response, there are already various comorbid conditions like diabetes, hypertension that are present. What precautions should they take to protect themselves from the new variant of COVID?
Okay, so right, like Dr. Chavan said, it is the same variant, the same infection with a different variant. As the treatment remains same, so does our shield and our armor to protect against that infection remains basically the same. The most important thing is to learn from the past 2 years and use that knowledge to protect ourselves and our loved ones. The most important thing here is to mask up. Use 3-ply surgical masks, cloth masks, and just hanging the masks around the neck is not sufficient. We should use the masks properly, cover the nose, cover our mouth. Second important thing is to get vaccinated. Whichever vaccine, whenever available, should be taken. Not only that, we should also motivate our near and dear ones to get vaccinated as well. Then we all know physical distancing should be followed. Frequent hand washing is the key to disinfect our hands and prevent the spread of infection. Especially when indoors, the areas should be kept well ventilated. Especially in the elderly suffering from diabetes, lung disease, or kidney diseases, it is also important to take vaccines against seasonal influenza virus as well as pneumonia virus. Then the elderly need to follow up with their doctors, be regular with their medications regarding various comorbidities, not just diabetes, but also blood pressure, kidney ailments, heart ailments, etc. So all these things can definitely prevent the Omicron infection. This infection is now becoming a global pandemic, especially in the Western world, and we need to be vigilant and be aware of all the precautions, because taking precautions remains our best bet against Omicron infection. Just saying that it is a less severe disease, and it would be prudent of us to just label it as a mild disease, because the infectivity is high. During the Delta variant, we had seen that there were almost 4 lakh patients per day. So if we consider the same scenario, it would be around 50 to 60,000 patients with severe disease per day, which can easily overwhelm our healthcare infrastructure. So taking precautions and prevention is our best bet against Omicron.
Right. Also, Dr. Chavan, portion control and a balanced diet are key factors, to lead a healthy life, and also very important in the management of diabetes. But when it comes to elderly patients, it does become difficult. What type of diet should elder adults with cardiac ailments follow?
Right. So diet is a very important part in the treatment of patients with heart disease and even diabetes. And portion control basically means how much to eat. So you need to choose a right quantity along with the right quality of food. So elderly patients maintaining a proper guideline based diet is very difficult. Their calorie requirement are less. So excess overfeeding, high calorie diet lead to any excess calories get deposited as a fat in the body, and that leads to all the complications. So avoid overfeeding, take multiple meals and multiple and small meals. So basic dietary advice for elderly patients with heart disease is to reduce the calories, take more vegetables, less of fat, more of proteins, high fiber, and low salt diet. So basically, use whole grains and because they are a good source of fibers. Use daily fruits and vegetables more because they are good in nutrient, more of fibers, less of calories. Use good source proteins, mainly animal source proteins from the dal, and you decrease the animal source proteins like red meat and replace it with fish or egg. And in decrease the fat intake, especially saturated fat intake, to less than 10% of the total calorie intake. And unsaturated fats, poly or monounsaturated fat, are good, and you can choose oils which contains mono and polyunsaturated fats, and you can choose anything between olive oil, soybean or sunflower or rice bran oil, but moderation is essential. We need to keep the oil less than 15 ml per day for any adult population. Uh, Decrease the sugar, overall sugar intake, and decrease your salt intake also to less than 2 gram per day.
All right, so that's crucial advice in terms of portions and also ingredients for salt and oil in your daily food. Well, Dr. Maldar, if I can ask you, diabetes is known as a disease of many complications. It does affect many organs of the body. Which diabetes complications are common in elderly people, and what's the best way to prevent it?
Right. So the complications of diabetes, they are a function of the duration of diabetes and control of diabetes. So as persons with diabetes are living longer, they are vulnerable not only to traditional complications of diabetes like heart disease, stroke or paralysis, diabetic foot ulcers, kidney disease or retinal diseases, but they are also more prone to diseases which occur in the old age like falls and fractures, dementia, depression, decrease in vision, hearing loss, etc. 1/3 of the elderly population has diabetes, and almost 40% of the patients more than 65 years of age remain undiagnosed of diabetes. So the first thing is to get regular health checks, get your fasting blood glucose levels and HbA1c checked regularly, and diagnose the patients with diabetes earlier. The most important thing to prevent complications of diabetes is to control the blood glucose levels. Not only high glucose levels, but even low glucose levels are equally detrimental. Proper healthy diet, daily walking if feasible, avoiding smoking, avoiding alcohol, getting early treatment for other comorbidities like blood pressure, high cholesterol, heart diseases, getting vaccinated against influenza, pneumonia, hepatitis B, etc., taking proper care of your own health, proper regular follow-ups with your healthcare team, and being regular with the treatment. These are the cornerstones of preventing complications. One should get an yearly eye check, dental check. One should take care of their foot, diabetic foot care. These are the things which can, prevent the complications and help diagnose the complications early.
All right. Well, that's important advice coming in as well. We're going to slip into a very short break, but our doctors will be live with us on the other side. Stay tuned. Welcome back. You're watching Health and Wellness, Myths versus Facts. Panel of expert doctors is with us on the broadcast. Dr. Chavan, knowing your numbers is also an important part of keeping, your health in check. What is the target blood pressure and cholesterol that elderly people with heart diseases need to maintain?
So basically, blood pressure and cholesterol both are important risk factor for heart disease along with diabetes, and both blood pressure and cholesterol are no more a disease of rich population. They are equally affecting poor and middle class population in current era. So to keeping in control is very important to avoid heart diseases. So for blood pressure, target is to reduce less than 140 by 90, which is a hospital or in office reading. If you're taking a home blood pressure reading, which is slightly less, which is less than 130 by 80. And anybody who is having a existing heart disease, previous stroke, kidney disease, or heart failure, our target is to keep the blood pressure less than 130 by 90, 130 by 80, sorry. And elderly patients, especially those who are more than 80 age, we try to keep the target slightly higher, which is 10 millimeter of Hg more than the normal adult population, because they have a tendency to fall because of low blood pressure. In terms of cholesterol, we read cholesterol reports in terms of fractions of cholesterol, that is LDL, HDL, triglyceride, and VLDL. So amongst which LDL, which is something called as a bad cholesterol, is most important target to achieve to prevent from the heart diseases, strokes, or peripheral artery embolization. So to LDL target for patients who are having existing heart disease, that means they have undergone previous angioplasty or bypass surgery, or already having existing blockages, and those who are diabetic, they are considered as a very high risk group, and for them the target is to keep the LDL level less than 70. And other high risk or moderate risk group, they are divided as per the ASCVD risk scoring, which is available online also. For them, the target is to keep less than 100 and less than 150 respectively. Triglyceride is one of the important cholesterol part which is seen in Indian population. Triglyceride is often high, especially in diabetics, but triglyceride more than 400 needs a treatment. Between 200 to 400, they can be managed with the diet and exercise also. And about HDL cholesterol, which is a good cholesterol, we need to keep more than 40 for males and more than 50 for females.
All right, Dr. Maldar, people who have diabetes also often have poor sleeping habits, including difficulty in falling asleep or staying asleep. It happens especially in elderly people. How much of a factor does sleep actually play?
So, like you rightly said, elderly patients, especially with diabetes, they don't only have problems of initiation of sleep or going to sleep, but they also have issues with staying asleep. Elderly patients, especially with diabetes, they are more prone to complain of daytime sleepiness, and they are twice as likely to be on sleep medications as well. Usually, sleep is considered as a very passive phenomenon. However, sleep is actually a very active and a dynamic process, especially the third wave sleep, which is a slow wave sleep. Third stage of non-REM sleep, which is a slow wave sleep. It is especially rejuvenating, refreshing, and is restorative sleep. It not only restores the brain functions, but it also positively modulates the endocrine diseases, endocrine issues, the cardiovascular system, as well as the metabolic system. In an adult from 20s to old age, the duration of sleep remains constant. However, actual amount of or actual hours of nighttime sleep may vary from person to person. So in a nutshell, the quantity of sleep is much more important than the quality of sleep. Although 6 to 8 hours of sleep daily, a refreshing and a restorative sleep should suffice in majority of the individuals.
Right. Also, Dr. Chavan, older individuals face a lot of stress. There is a combination of emotional and physical stress because of chronic conditions. What tips would you suggest to alleviate that?
Right. So stress is an important factor for precipitating many events like heart attack, heart failure, rhythm disturbances. And managing stress is very important to avoid these recurrent admissions because of stress in existing heart disease patients. So elderly patients get stressed because of multiple factors like existing disease condition, financial support, poor family support, and many elderly people get stressed because they are afraid of being dependent on others. So, as saying goes, that this it is not the stress which kills us, but it's the reaction to it. So, actually, individual person's reaction can be changed, and it depends on the person to person. But I guess good family support plays a vital role in relieving the stress. Uh, Along with that, having a good social life, having a good healthy diet, adequate sleep, good keeping their habits alive, doing exercise and yoga, all these things reduce their stress level and even divert their attention from the medical illness.
All right, well, crucial information there. Thank you, doctors, very much for joining us on this edition of the show. Thanks for watching.